Hello and welcome to the Doctor's Corner. I'm your host as always, Dr. Mark Pinsky, and today we have a really good show for you. We're going to discuss medical marijuana. I know I'm a little overdressed, Sumeet, but I really should have worn my tie-dye. We should have gotten a leaf in the background, but we didn't.
In the background. Yeah.
But we didn't do a little Bob Marley, right? It would have been awesome. Anyway, we're here with Dr. Chandra, who I will introduce or allow him to introduce himself. Sumeet, welcome to the show. Talk to them about who you are and what you do.
Well, thanks for having me. And my name is Sumeet Chandra. I'm a board-certified hematologist oncologist. So my primary practice is medical oncology, hematology. But I've sort of branched out into medical marijuana more out of a need for my own patients and have expanded that into other indications aside from cancer.
Right. And I was very encouraging in that because my own patients, Dr. Chandra and I know each other incredibly well over how many years? Like 15 years?
Almost 10 years.
Is it 10 years?
Yeah.
It only feels like 15.
I know, right?
We talk very, very often, and I have a lot of respect for Dr. Chandra as a medical professional. And so to me, this was just a natural extension to what I think is a very important part of his practice, how to take care of patients who are critically ill and allow them to adapt to their disease and help them cope with their disease. So let's talk a little bit about the practice itself and the medical marijuana itself.
Sure.
So let's talk about medical marijuana from the perspective of therapy.
Yes.
Who qualifies for medical marijuana?
So the state has outlined probably about 10 to 12 diagnoses which qualify somebody to be able to get medical marijuana. And they can include epilepsy, Crohn's disease, cancer, AIDS, multiple sclerosis, things like that. Or any terminal disease is also, a person with a terminal disease is able to qualify for medical marijuana. They do stipulate that if you have a condition that is somewhat similar to one of the certifying conditions that you are able to get it as well.
Okay. So how does that go with people who, for example, let's just say have chronic pain, but we have a legitimate diagnosis? So I send a patient to you, right. Person has an MRI that diagnoses horrific, discogenic, degenerative disease. Do those patients qualify?
They do, but you have to basically bring in documentation and show the state documentation, like scans, notes from a pain specialist or an orthopedic surgeon in order to be able to justify use.
Okay. And when a person decides, listen, this might be a therapeutic option for me, and let's just use that as the most common, because low back pain for me is probably the most common.
Sure.
When they do that, they have to make a decision. They're going to do medical marijuana or other pain meds, correct?
No, they can be used in conjunction.
Okay.
We have had issues where certain pain management practices
Right.
will discourage their patients from getting medical marijuana. But for the most of the time, the majority of physicians use it as an adjunct to opiates or other methods of pain control.
And I think that's a very important point, because I've had this come up multiple times in my own practice, where we've had patients who've seen pain management people. We send them to you, and that's been an issue. So I really wanted to clarify that. So it just depends on the pain management person.
On the pain management person, I think each practice probably has their own policies in terms of each patient, case by case. So.
Okay, let's talk about some psychiatric things.
Sure.
All right. So what about things like anxiety? Anxiety a condition?
Yeah, especially, one of the certifying conditions is post-traumatic stress disorder. Okay. So anybody who sort of has PTSD and anxiety as a result, or anxiety as a result of any other qualifying medical condition, it's been, in my experience, a really wonderful way to treat anxiety.
Right. So I make the diagnosis, doesn't have to be a psychiatrist, doesn't have to be a psychologist. I make the diagnosis of anxiety. I can send them to you for therapeutic options.
Absolutely.
Okay, perfect. I've done it, so I know
it's
true. But, just for the sake of drama. So let's talk about the mechanism of action.
Sure.
How in theory, does medical marijuana work?
So the science is evolving, but what we know is we have an endogenous receptor system within our body called the endocannabinoid system. And we think that system is in place basically to slow things down, to slow down neuronal activity, pain activity. Right. You can find those receptors primarily in the central nervous system, peripheral nervous system, but you can find it in the GI tract. You can find it in immune cells. So it's there. So marijuana basically works on that receptor system. Yeah.
So that would be, since it's in the GI tract, that would make sense. That's certain
Crohn's
GI
disease.
disorders.
Exactly.
Now, they don't qualify, though, for things like irritable bowel.
No.
They don't qualify for any real GI disorders except for inflammatory bowel
Inflammatory bowel disease, exactly.
All right. Good point.
Yeah.
All right, because you're going to get like a million
Irritable bowel patients, right? I don't think it'll help for that.
I don't think. Well, we don't know.
Well, we don't know yet.
But we can't do it.
We don't know.
Okay.
Yet.
So let's talk about how it will affect an individual. They take the medication, and what can the patient expect?
So it depends on the route. There are different ways to prescribe it. There's smoking or vaping. There's sublingual drops. There's pills or edibles, or quote unquote edibles. So the mechanism of action, basically the time to onset, depends on what route you're taking. Right. So a pill, for instance, can take up to 1 to 2 hours to kick in, but will last up to 6 hours. Okay. Smoking it is almost immediate onset, but will last 1 to 2 hours. And in terms of how a patient's going to feel, it really is a little bit of trial and error. Right. Depending on what product you have, how much THC is in that product, because that's the component of marijuana that gives you the high. Right. So a lot of folks what we've been telling people is start low and increase it rather than going the opposite way. Right.
So do people become addicted when they take this?
No, not really. There's some studies that show that chronic marijuana use can lead to addiction, but I think with medical marijuana, when you're using it appropriately, the addiction potential is pretty low, I think.
Right. So I see that in my own practice when we share patients. I don't see people getting addicted to the process or the actual chemical compound. Right. I see a lot of people getting help. I see a lot of people functioning better. I see people doing things that they hadn't done in years. Yep. But I don't think people get addicted to the feeling of that. I think they're happy to just process and function.
And the biggest thing, one of the biggest benefits I've seen is people being able to come off of opiates, which as we know are horribly addictive. Right. And benzodiazepines and things like that. Right. And we've had a lot of folks who've come back, 2 months in, 6 months out, and said, I've cut my opiates and 75%, 50%, which has been nice.
Well, so that goes back to our previous conversation, right? The conversation dealing with, can you take these in conjunction, right? Yeah. I don't think it makes any sense, which is what I've talked about before, that you would expect someone who's been taking opioids for an extended period of time to totally come off of them.
And I tell people not to.
Right. It's a disaster.
Yeah, it's a disaster. You don't want to ever stop opiates or benzos cold turkey.
So people who I think are serious, as we have patients of all different realms, but patients who take their healthcare seriously, I think do the best because they really do want to come off the opioids, but they just can't do it. And I think this gives them that alternative to be able to do that.
It is definitely a nice way to, if not completely come off of opiates and benzodiazepines, but significantly cut back on them.
Well, what I like about this is now we have the ability to take them off safely, right? I don't have to just wean them off and pray and hope. I can wean them off because there's something else on board. Yes. And I can really tailor them slowly.
Yeah, the back pain is still there.
Right.
Whether they're on opiates or off opiates. Right. So now you have an alternative way to treat the back pain.
And I think people who are realistic, I do this when I send them to you. I say, listen, I'm not going to make you pain-free. The goal is not to make you pain-free. The goal is to make you functional. Right? So if I took your pain, which you listed to me now as an 8, 9, or 10, and I told you it was going to be a 4 or a 5.
You take that.
You take it.
Yeah.
You think it was a win.
Right.
So you got to remember that when you become a 4 or 5, because the human nature is I want it to be 0.
Yeah, of course.
And I got that. Right. One of the things you mentioned was about vaping. So I want obviously there's been this huge press about vaping, and I want you to sort of dispel the notion of vaping versus what you do with medical marijuana.
So vaping, we know so far is that it's more related to some of the additives used in the flavoring for vaping. Right. We don't do that with medical marijuana. So there haven't been any reports that I'm aware of that people have had any lung injury due to marijuana vaping. It's mainly the sort of the nicotine delivery system with all the additives, the flavoring additives that they use.
Right. Okay, let's talk about the process.
Sure.
So I have a patient that I need to come to you. Tell me what I need to do to get the patient to you.
It's pretty simple. They call the office. They mention to the office, the staff, that they would like to make an appointment to be evaluated for medical marijuana. Right now, we currently do it once a week on Fridays. They come in, make an appointment. They get triaged just like any other doctor's appointment. They get vital signs taken. things like that. They come in in the exam room. I talk to them, sort of discuss what their goals are, why they're there, do a quick physical exam, and if they qualify for one of the certifying conditions, I just go in and do it right then and there. And then the turnaround time from when they see me to when they can actually go to a dispensary is about 2 weeks.
Okay, so before we go to that process right there, do they have to be referred by another doctor to you, or can they just call you?
They can be self-referred, but I have to have some medical documentation. I need medical records to document.
That makes total sense. Yeah. All right, so then let's talk about that process. They come, you make the decision that they qualify for medical marijuana. From your end, what has to be done? Because I think the people need to understand that from your end, you have certain things you need to do before they can go to the dispensary.
Right. So basically, at the time of the visit, we're going to discuss the different ways they can try it. Again, we talked about delivery systems, oral, sublingual, topical, creams. We have a discussion. We decide, yes, we're going to try this. I go into the state system. I put in their information, their demographics, say they're qualified, and then I will put in which routes that they can get at the dispensary. So that'll all be in the system.
Right. So that is that decision on the routes, is that done by you, or is it done in conjunction with them?
That's done by me.
That's done by you.
Yeah.
And you make that decision based on
patient preferences, what they're trying to treat. If someone has chronic pain, they can't sleep at night, I'm going to recommend we do a pill because that lasts about 6 hours. If they have nausea due to chemotherapy, which I see quite often, you don't want to wait 2 hours for that to kick in. So, we'll recommend a faster acting.
Okay. And then you can do both, right? So if you need the faster acting and then you do the pills.
Absolutely.
So that's where I think the art comes in of figuring out, the science isn't quite there yet about figuring out exactly how to do it. It's just really trial and error.
Exactly.
Okay.
Yeah, it is. Right.
And then they go from you. They get permission. They go to the dispensary. Tell me what that process is like.
So a good dispensary will have a consultation with the patient and will, similar to me, take a history and say, well, what are you going through? What kind of symptoms are you having? And what we found, there are some very good dispensaries who will spend the time, take the time, and and then based on that, figure out, okay, let's try this product, this strain, that hybrids. The amount of THC we need. Do we need a lower level of THC, a higher level of THC?
And do they keep records of that? They know the record of what they give, and just like we have in our chart,
Absolutely.
They have a record.
They have a record of what the patient.
So then they come back in. Let's say they get this, whatever that is. Yeah. Then they come back to you in a month.
I usually see them back for a 2-month follow-up.
Okay, 2 months.
And if everything's going well, then I'll see them every 6 months going forward.
Okay, what if it's not? Let's say they're having problems in between. So they go to the dispensary, it's not quite working, or they have side effects to it.
Right. So then we'll have a discussion about that.
Then they come back to see you.
Yeah, and we'll say, let's try this. Let's talk about a lower THC.
And then you make lower THC or whatever.
Whatever, yeah.
And then so you make that decision, or you help. And the dispensary makes the decision.
It's all in conjunction.
So there's a team effort.
There's a team effort. We're all talking to each other. I get calls from dispensaries all day.
Do
this, do that. Yeah.
So, but I think that's important.
That's a good thing.
Yeah, that's a good thing because honestly, if I got more calls from the pharmacy, there would be less errors than we have right now.
That's true.
Now the EMR has helped, right?
Well, and also the good dispensaries, they have folks who are experts in this.
Well, that's what I was going to ask you.
Yeah, they know more than I do. About different strains and hybrids. And
their knowledge is amazing. If you want to learn anything about any of these things,
go into a dispensary. They
know everything. So it's really good because these people some of them have just used marijuana their whole life.
Yeah.
Some of them have just learned from seeing lots of people.
Right.
And I suppose that my message there is that not all dispensaries are created equal. And so relying on professionals like Dr. Chandra who know what dispensaries you should and you should not go to is a very viable tool. Because I can tell you that when it first started, nobody really knew that there was going to be a difference in the dispensaries.
No.
And now I hear, I went to this dispensary. It was terrible. I went to this. It was amazing. Yeah. These people were super knowledgeable.
Yeah, and they took the time and they,
Right. And so they will help guide you. So they'll call you and they'll say, hey, listen, I think Mr. Jones could use a little bit of...
Yeah, absolutely. Okay. Yeah.
And so what's the time frame people can stay on it?
Forever.
I mean,
there's no time frame. There's no sort of...
And have you noticed in the time that you've been doing it, Have you noticed that there's a tolerance that's built up so where people have to use more?
So that's part of it. If someone has smoked marijuana recreationally for a long time, you obviously need to have a higher percentage of THC and that kind of thing. But yeah, I haven't seen it yet where people develop a significant tolerance. So I haven't had that issue come up as of yet. But I'm sure as we go along in this, it's still relatively new. But as we go along, I'm sure we'll run into some issues with that as well.
And I suppose the one question that we didn't answer is the question which we always worry about with our opioids, right? Can you overdose on marijuana?
No.
Okay, there's never been an
anybody who's had any overdoses on marijuana.
Give me some of the common side effects that people see. Not the, just the common ones.
Well, the biggest one is the high. I've had instances where, patients will take too much and they'll be high for...
Well, if a little is good, so a lot's got to be better.
Yeah, exactly. And they'll be very high for 24 hours or 12 hours or 18 hours. And that's the biggest thing. But, some people get dry mouth, paranoia. Those are the most commonly described kind of side effects. But again, then you go back to the dispensary and say, hey, this made me too high, so I need a lower percentage of THC, I need a different strain, or I need a hybrid, something.
Right. Let's stay focused a little bit on some of your critical patients, because you have some really, really sick people. And I think that when I was going through my training, if we had this ability, it would have been so much nicer.
Yes.
One of the really awful things about going through chemotherapy and about treatments is the terrible side effects to those medications. Yeah. How has this changed your practice?
It's been amazing. Yeah. So I would say the vast majority of my patients going through treatment have seen me for medical marijuana. And I have seen some pretty remarkable responses. People, when they're on treatment, don't want to eat. They don't have an appetite. Their appetite improves. Nutritional status improves, which is important to get through treatment. Especially now as cancer has become more of a chronic disease in a lot of cases, and people, unfortunately, have to stay on treatment for a prolonged period of time. It's a nice way to manage all those side effects that come with it. Yeah.
Okay, that's terrific. Yeah. What are the things that we not discussed that you think is important for people to know?
I think, the stigma behind it. There has been a lot of stigma, and I think that's going away, and it probably will be gone. But, if it's something that you're interested in, it's important to at least have an evaluation.
Yeah, I'll be honest with you. One of the things that's always scared me and why I've never, ever, ever tried marijuana, because I'm a control freak. And I've never wanted to be out of control. But I do think that as the science gets better, and to me, this opens up the science.
Yes, absolutely.
Just as pain management became a specialty, I really do believe that there will be a residency on medical marijuana.
Totally agree. Eventually, this will become legal federally. So it's currently not legal. And so as a result, a lot of research funding is tied up because that's given by the federal government. I know. But that's going to go away soon. I think as we know about the science, I completely agree. It's going to be its own specialty. You're going to have people specializing in it.
And I think what they'll do is, just like when we started prescribing antibiotics way back in the day, they'll look at us and go, really? That's what you did?
Yeah, exactly.
So I think the science is going to get so good that we will be able to identify indications for specific doses and specific delivery systems of THC, which will really help patients.
And there's an evolving science about even therapeutic potential for some of this stuff.
Listen, I'm excited for
it. It's really fantastic.
Because what I see now, and of course I'm on the front lines every day and doing a lot of musculoskeletal medicine, Sumeet, I just see some of the worst of the worst. And the opioids are a disaster.
It's reckless.
And you can't really, there's no really good way to regulate the use of the opioids. And no matter what I do, if a person's in their 40s and they go on opioids, they are going to get addicted to opioids. So, you have this long, extensive conversation, but when a person can't function,
you're left
what am I going to do?
Yeah.
Right? You have no choice. Yeah. So, I think it's amazing that you have to get. You can drive on opiates and nobody says anything, but you can't have a firearm and have medical marijuana, correct?
So, no, that is actually
not correct.
Legend. Yes, that came up. That has come up when I first started this a few times, where folks would come in and say, "But I can't do it because it turns out you can have a concealed
weapon." You can have a concealed weapon.
Yeah.
Okay, that's a big thing. I did not know.
Yeah.
Okay, good. Not that I want to do medical marijuana, but I think it's important because I do have a lot of patients that say that to me.
A lot of people have a concealed carry permit. Yeah, absolutely.
Right. Now, because I find it preposterous, right?
You
get
can
just
drink
this-
and have a concealed carry.
Yeah,
permit,
yeah. So
like,
what's
yeah,
what's the
exactly.
difference? And here's what I notice. I notice that my patients who are on medical marijuana actually function much better.
100%.
And I think that they're much more serious about controlling and not abusing. They tinker with this.
Yes,
And
absolutely.
they want to get it just right. And they do have the ability to do that where they can't do that on opioids.
No.
So this allows them some laxity, some freedom to figure out what works for them.
And that's the one thing I do try to reinforce with people is that this is not an exact science. It's a little trial and error. So if you try something, it doesn't work, try something else. You have to kind of stick with it and tinker, like you said, with it. And eventually you will get to a point where you'll have some benefit from it.
I totally agree with that. All right, did we forget anything?
I think we're good. I think we covered it all.
Jeremy, did we cover everything? We're good? All right. For Dr. Sumeet Chandra, I am Dr. Mark Pinsky. You have been watching The Doctor's Corner. See you next week. This is Dr. Mark Pinsky once again, asking you to forward questions to us, whether regarding this episode or any of our past episodes, at drmarkscorner@gmail.com. Also, don't forget to check us out on our website, pinskywellness.com or pinskyweightloss.com. We look forward to hearing all of your questions, and we'll get back to you as soon as we do. Y'all have a great week.